Well, we're about 18 months into the COVID pandemic, and numbers are once again on the rise. The highly contagious Delta variant has Washington state and much of the country battling a late summer spike. We're now joined by Matt Hanson with the Public Health of Seattle and King County to find out what we need to know. If you've already been vaccinated, what's next? Thank you so much for being with us, Matt.
Thanks for having me on the program.
Absolutely. So first question is, what's different about the Delta variant?
Well, as you said it initially, it is a much more infectious version of the virus we've been dealing with this last year and a half. It's spreading twice as fast as the original strain. And a couple other things about it. Vaccinated people can also spread the Delta variant, but they do so for a shorter period.
Okay.
And there's some evidence to support that it can cause more severe disease.
Really? All right. So when you mentioned that vaccinated people can also be spreading it, a lot of people have said, well, why should I get vaccinated then if I'm going to get it anyway and maybe spread it? What is the answer to that?
Well, I'd say with so much community transmission right now, there's no vaccine that's 100% effective. None of the vaccines we have are. So we can have what we call breakthrough cases.
Okay.
But the thing is, you might get a little bit ill and you actually test positive. But the thing that the vaccinated folks won't have to deal with is a more severe disease, hospitalization, death. So the vaccines are extremely effective in preventing that.
Yeah, that's what they told me when I got my vaccine. They said, well, it's almost 100% effective in preventing death, which for me is key. About the Delta variant, how is it impacting King County specifically right now? What are the numbers looking like?
Well, it's hitting us pretty hard. At the end of June, we were roughly 50 to 60 cases per day. But then Delta started rising in prominence around here, and we had lifting of restrictions, and we still have quite a few unvaccinated people. So altogether, those things contributed to quite a spike in cases, where now we're roughly 450 cases a day. Hospitalizations have also gone up, but to a lesser degree. And luckily, deaths have not changed. If anything, they've gone up a bit.
That's actually very good news. So with the Delta variant, can you test for this specifically? I'm assuming you can.
Mm-hmm. Yeah, so the test that we all probably have experience with personally or that you've heard about, so the nasal swab with a Q-tip, they send it for what's called the PCR test. And then from that, when there's a positive test, that's sent on to certain labs that can do genetic sequencing. And with that, then we can find out what specific variant it is.
Okay.
And we're probably doing that with maybe 25% of all of our positive cases now. And almost all of them are what's called a variant of concern. And nearly 90% of those are Delta now. Because Delta is so infectious, it's kind of taken over.
All right, so I'm going to ask the question, of course, that every parent is wondering, because we're seeing more kids being affected by this variant, which they weren't with the initial COVID spike protein. So is it more dangerous because it's more infectious, or is it that kids are just more vulnerable?
Well, I think kids still, we don't have approved vaccinations for under 12s. Hopefully that's coming later this year. But for some reason, as has been the case throughout this whole pandemic, this has primarily impacted folks that are older and with various medical conditions. And for some reason, it has not impacted children as much. I think we can all look forward to the day when we get vaccines approved for kids. And as I said, that's probably going to be coming later this fall.
Okay. We got about a minute left, so I just have to ask, what are we doing to get more people vaccinated in King County right now?
Oh, I think there's many efforts underway. And first of all, I would applaud just the citizens of King County and all of the healthcare workers and various community groups that have promoted vaccination, because we're a bit of a national leader in terms of our vaccination program here. And just a week ago, I think 70% of our entire population reached one dose. And that's even including, kids under 12 in the overall denominator. Wow. And if you're just looking at the eligible folks that are over 12, we're probably 76% that are fully vaccinated in the county, which is amazing. But still, that leaves hundreds of thousands of people susceptible, and some communities more so than others. So we're working with various healthcare systems in the area, various community groups to of course, get out the message, to make sure we can address some of the concerns that people have and meet them where they're at to try to get them vaccinated. But I think we've made a lot of progress, but we still have more to go.
I was going to say that outreach is incredible. Thank you so much, Matt. I have so many more questions, but I'm going to let you go because I know you're a very busy man. Thank you for your time.
All right. Thank you for having me.
We'll talk soon.
All right. Have a good day.
You too.